wanna stay strong. You wanna live long and stay strong. Ogun bílẹ̀ afúnni ni wọ́n sọ, olóyún abẹ́rẹ́ láì ṣiṣẹ́ abẹ́, ewé ń jẹ́, ogun jẹ́. Má ṣe lògùn without doctor's prescription. Mo tẹnumọ́, all in doctor's attention if you need solution. Mo tẹnumọ́, too much is given, much is expected. Ìlera lọ.
Under the sun or in the rain, with dedication and selflessness, Nigeria's ours, Nigeria we serve.
Today is a new day in the life of Sickle Cell Disorder Foundation. We are doing a novel project today. We have decided that the corpers, the National Youth Corpers, are important people, educated, and can be used as a medium of change for influencing the reduction of sickle cell disease in Nigeria. So we brought them together from the local government near us here, and we have over 250 candidates here today, learning and knowing what it is to influence themselves, their families, and their communities on this disease. There's no age limit. They can marry at any time as they wish, if they can find a lover. Once they find their lover, they can go ahead. But what we tell them is this: make sure that lover knows all about you and you know about the person. Don't let's hide anything. Let's not hide our genotypes. Let them both know what is ahead of them so that they can understand together how they will take care of themselves when they get married. They can get married at any age that they feel. All member has a lot to take home. A core member knows that he's coming here today is not in vain. This is a new program that SCHAF has decided to do, that we should empower people by educating them. Education is a leveler. Education puts you at the right perspective, so that you know that it is not only the subject you learn. This is extra curriculum learning, and when you do it properly, you get it right, you can influence yourself by taking informed decisions. That's what you should take home. Number two, you can go back to your families and influence them by doing correct genotype for them for 3,500. The family, the children in the family, you can help them. When you start your work, get them to visit you and do correct genotyping for them. When you are assigned to another community or to your own work, go there and talk about the right perspective. And if you need help, call Sickle Cell Disorder Foundation. We'll come and help you there. And that's all. The corpus should be a medium of change. That's what we are calling them today.
I'm happy to be in your midst and to be in this program this morning. We are here for a day training program on sickle cell disease. When we talk of sickle cell disease, we know the hard work that is doing even in our nation. For those of you that have seen one carrier of sickle cell or others, we know that it is a disease that must be dealt with. And I know this program you are here this morning will be trained so that we will be in position, we have first-hand knowledge and information about the disease. Be able to tell down whatever you have learned. Be able to educate the youth outside there and those that are about to get married on the danger of sickle cell.
I'd like to welcome you, and I'm happy I'm here to interact with you because I started like young graduates, and I'd like to thank your director and the NYC team for allowing a team, the Sickle Cell Disorder Foundation, to be here to give you the knowledge, because I believe very much in sharing knowledge. Even that's why I'm here today. But because she still wants to share knowledge and also ensure that she passes on the torch so that you too can help us with your own generation, and they can also keep on, and we can all help these patients with sickle cell disease that they refer to as warriors because of what they're going through in life. And not just the patients, but also their families. And the aspect of compassion is also very important, especially in our society. I'm happy that NYSC corpus, you cut across all professions. You are not just medical. I've just spoken to one of the leaders here, and they told me that you are from various disciplines, and I'm very happy about that, so that you can help us impart whatever you learn here on, not just on the corpus, but those you are going to interact with after you finish your core, when you are also professionals in this country. Because our aim in this country to make this country a better place for who? Everybody.
Genotype are the genes that are inside the red cells in your body. The genes inside the cells, inside the body of biology. The red cell, then inside that hemoglobin, the genes are inside that determine the type of genotype they have. At the exterior part of the cells, that is on top of the red cells, there are also genes that determine your blood group. So when you do the hemoglobin genotypes, that the phenotype these are the different types you have. You have over 141 types of changes, but we are mentioning the ones that are common and the ones that affect us easily. So there is AA, which is a lot of people, AS, SS, AC, SC, SD, SG, SO, AE, and so on. But we will not mention those ones because they are few and they don't really affect the company. And as I explained that one is, if you have somebody there, this lady is there, right? Stand up. The one next to her is down. Stand up. These are two young women. They are both girls. They are all doing very well in school. They are all going to get married. They are all going to have children. But one is there, one is dark. That doesn't mean anything. That is why some hemoglobins here, there are many I can't be telling you about today, but they don't affect us more, so we won't talk about it. But the ones that affect us, so the blood group is usually used when you have your driving license, or when you are going to have a baby in the hospital, or when you have an accident. That is why many people know more about blood group than about genotype. And once they tell them your blood group is A, some of us just go out there blindly and say, what is your genotype? I'm A. I'm AA. Please, you are educated folks. There is a world of difference between blood group and genotype. That's what we are here to learn and be above our partners, our colleagues out there who can explain. You can now read about this on Google. Learn more about it. What does it do to us? If you have an accident, nobody is going to transfuse you without doing your blood group. Nobody. They will do your blood group. They will match the blood they are going to give you with the blood group before they give it to you. If you are having a baby, they are not going to throw some blood into your body without checking the blood that is coming in. So there are reasons why these things are different. But in the case of the genotype, it's a different thing. It tells you the kind of gene, and then it shows the kind of pathophysiology. What is sickle cell disease? This is the normal blood, normal red cells in the body. If you prick my finger now, these are the kind of red blood cells that are going to come out, that you can see under the microscope. If you have somebody with excess in this gene, when you prick their finger, you will see some of these cells inside. And what do these cells do? They move in the bloodstream, but they gather together, they clump together, and they cause trouble. It's not their fault, shape. Because of that change in the gene, there's a position change at beta 6. I don't want to confuse you.
a lot of times. I want to be down to earth. Beta-6 position of hemoglobin, there is a change. And just one glutamic acid changes to valine. And this is the outcome. That's the sign. So when these cells are moving in the bloodstream, so what happens is when these cells are coming from the big sinuses, here and here, they get to this, they only live for less than 50 days sometimes. Compare 50 days and 120 days. So there is a problem. It's not their fault. It's just the makeup of the cells.
I do know a life-threatening issue for a mother with SS to go through level, because due to the pains and the complications of sickle cell, I don't think it will be healthy for her, for a mother with SS to go through the carrying of a baby for 9 months because of the leg ulcer and even to the stage of giving birth. My second question is it possible for blood group to change? Like someone that has O plus and the blood group later change to B plus. You understand? Thank you.
After a stem cell transplant, can the person's genotype change? After a stem cell transplant as a sickle cell?
When somebody is already an SS herself, how can she be going through childbirth? Of course they do. Of course. We even have them, they come with their babies after. You know, we are not all the same. As I told you, I said there is something that is called beta hemoglobin. I didn't go into the science. There is something called beta thalassemia. When somebody is S beta thal, it will show like an SS. Her own disease is not as bad as the one that is SS. So she can go through it. But just the problem we have in Nigeria is that we don't have designated laboratories that are supposed to be doing all these extra things to be able to tell you, this one you need to further examine and confirm. If everybody comes as SS, even some SC don't know their SC, they just are sickle. Everything is just muddled up. So there is a variation. It's a family of disease. The sickle cell thing is a family. There are some SS, there are some SC, there are some S star, S beta star. They all have different pathophysiology, that is, they present differently. So some of them may be S beta star, and then they go into pregnancy, and then they will come out of it. I have many of them in my sickle cell membership who have got 2 children. I have them when I'm seeing them end of the year, come to my first year of December, come to work. You will see people with sickle cell children with their own babies. So we have many that are good and they are doing well. And then this idea they will die is they are not going to all die. Mama Oliko in Lagos lived to 95 years. So we are not all the same. And then the care is not the same. Somebody comes from a home when they know there is malaria, you lose your net. You are not going to line up at the garage waiting for a bus for 1 hour when your leg is bleeding. You have a driver to carry you. Then you get to your home, there is food to eat, nourishment. So that will build up your blood. Your daddy has a doctor to take care of you. Definitely the environmental effect also helps these children to feel better. They don't have to die at 15 and 17 and 5 at something. You go to the burial ground, all the people there are not SS. Can we understand that? Everybody in the burial ground is not SS. So everybody can die at any time. Don't let's label them that they will die. But they have challenges. Their case notes are big like this because they need care. That's what we are telling you. So don't label them with death. They can die, they will not die. So we don't know. Number 2, you said, so they can have children. No, please, they can have, if they choose to have. If their husband is here and loves them and will take care of them, the care is important. Number 2, you said, can O positive change to B? I didn't get that one very well. O blood positive blood group cannot change to B. Cannot. It doesn't change. It's the same one you have. The only thing is when they want to transfuse, they will test you. They will test the kind of blood they can put in you, and they will make sure that it's the type that is your own.
what they give you. But where a problem comes in, let me tell you something. If a woman, for example, is an A negative by herself, and then she gets pregnant, and the man that is the father of the child is a positive, are you listening? This child is coming in the womb and is carrying the resource is the plus or negative of the father, and is going to sit inside this woman for 9 months. You can imagine the tussle going on there. There is a fight between that blood of the baby and the blood of that mother, because he is living inside that mother. So when people are negative, they are supposed to know ahead of time, and they're supposed to know, go to a hospital that is good for their delivery. So in that hospital, they will already arrange something that is called program for them, and within 48 hours they are supposed to have taken that program, so that that child will be born with jaundice, but it will not sensitize the blood of that woman towards the next child coming in the womb, because the husband is a positive. Every child that is coming must take something from the father and take something from the mother. So if that woman is sitting down there with her negative and the husband is coming with positive, there can be a problem. But once she already goes to a good hospital, that's why we do prenatal care. Now women will hide in the house, they say, I don't have money to go and give them market women. They won't go until they are ready to deliver. Then the problems come. So this is what knowledge does for you, that allows you to know what you should do. So all doesn't change to B, but you need to know what you are. Are you O negative, B negative, B positive, whatever you are, or A positive. So that you can be ready when you are having babies, especially the women, so that you can give your blood correctly and move the knowledge. The third question is, after transplant with the genotype change, of course, the reason for the transplant is for us to give you something different from what you are. So if somebody is SS, you want to go and do gene transplant, they are going to make sure that the genes that are coming in are genes with A. If you do bone marrow transplant, they will wipe off your bone marrow from the SS and give you bone marrow that has AA. But that's not the only thing. They will match every other thing inside that blood, because there are many other things that can fight against each other. So it's not a simple process. You can't just say, I'm going to do bone marrow transplant like that. It costs a lot of money. You do it in special places and you give special care. Even after the bone transplantation, the bone marrow transplantation, you have to be in special groups, special air to breathe, and so many things. But we cannot afford it. Don't let's stretch to the one we cannot afford. Let us start from the beginning. Prevent it. Prevention is better than.
Prof, I want to say that it's something.
All right. Good afternoon, everyone. I'm happy to be here with you, looking at the young minds that are here. You are highly privileged. You are highly privileged to hear what you are hearing. Are you getting me? And this is the best, one of the best times to hear it. Although you're supposed to know about it right from young age. And I'm thinking, if we know so much, we won't have so much of the cases today. There is this attitude in Nigerians that if something doesn't kill you, another thing will kill you. Don't have that attitude. Is that alright? And love is blind. Is love blind? So it's always good for you and for your children to know their genotype. Are you hearing me? Very important. And you hold it very well, and you do it in a very reputable place. This our generation is blessed to have Professor Falusi. Can we clap for her? Can we say closer to her? SARS.
There's a 1 in 4 chances of you having sickle cell disease. You have that wrong notation that if, for example, I'm a sickle cell carrier and then my spouse is also an sickle cell carrier, then if you have 4 children, only one of them will be sickle cell. No, it means every time I'm pregnant, I have 1 in 4 chances, 25% of giving birth to a sickle cell child. So forget about the mathematics of let's have 4 children. 3 will be okay, 1 will be sickle cell. No, you could have 4 children and all 4 will be sickle cell. So please take note of that. So what the nutshell of what we've heard from Prof is that it's not a death sentence. It's not a life imprisonment. Somebody said, oh, but I have an S in my genotype. I'm an AS. I'm a sickle cell. I'm SS. Are you saying that I'm condemned to not having a joyful marital home? No. What we are saying is that don't mate with somebody who is also a sickle cell carrier. Mate with somebody who has an AA genotype and you are good to go. Okay, so what's the point that we are saying now? The bodies that are associated with sickle cell, there's a financial body, okay? And the financial body will look at, a study has been done and an estimate made at how much you spend roughly per month, okay? How much in this environment. And take note, we look at the year of that study, I think that was 2020. You and I know that amount will definitely have increased by now with the increase, in prices. Then there's the economic body, okay? And then the bodies, there's the emotional body. I mean, look at what my boss, my organist, my supervisor, President Bola, help me celebrate her once again. What she said. Imagine the horror for that parent that have lost that lady and then to university level. They are thankful, they are grateful, they are hopeful that they also come to celebrate, only for our life to be cut short at final year. That's an emotional trauma. I mean, nobody knows when they'll be able to recover from it for a long time. Talk less of the financial body that has been associated with maintaining that individual.
Now, what are we doing? Point of care genotype screening, right? So, point of care simply means that a test that can be accessed, okay, at maybe a doctor's office, community pharmacy, a maternity center, that is outside the traditional laboratory, right? So that a lot of people can have access to essential diagnostics. That is what point of care testing is, at the time and place of care, without you going up and down. A lot of tests can be done now at the point of care, including kidney function tests, chlamydia screening, and all of that. So genotyping as well can be done at the point of care, and research has shown that it is 99% accurate and can accurately distinguish genotype S from C with 100% accuracy, unlike the old method that has been shown to have 100% inaccuracy in that so the inaccuracy is high for the old method when it comes to S, distinguishing S from C. Now, this is genotype SC. As you will see, it will be demonstrated for you here. This test runs using water, plain water, that is it. No power failure. It's not an equipment you have to carry from one point to the other. And it cannot be reused. So if it's used for you, we can't say, oh, let me manage the resources. Like it was said before that some people will wash cellophane and certain paper and then try to reuse it. It is not possible with this. Then it is easy to read, no reagents, and it promotes early diagnosis. So these are the benefits. It is transparent, it is accessible, it is linked to face ID, and you will always be able to retrieve it.
The leadership of Professor Falusi have taken that challenge And that's what leadership is. Leadership is here to identify problem and solve it. For so many years, as long as I've known her, she's my mentor. She's been fighting this sickle cell disease through research and now through public health means, awareness and management. So everybody should be involved. The media, the youth corps, the young, the old, the church, the mosque, every human being, because you cannot say it does not affect you. It's a challenge. When people have sickle cell, they come up with sickle cell disease rather, they come up with all sorts of afflictions, and which we have highlighted here. And at the end of the day, some of them do die. We don't have even enjoyed their life before that. And so we are here, and we've given so many life experiences. I've given my experience as a lecturer, as a vice chancellor. So it affects us like the examples I gave. So I think everybody should champion it. The champion now is prevention is better than cure. Create awareness, let people test. There are better tests coming up. Before, you need to do a ELISA, go to the lab, laborious means of finding out your genotype. Now we have what we call point of care means, which is 99% accurate. So why don't we use that? Something that is accurate. We're even going further now, like we just heard, to automate the result, digitize the result, so that you don't have to carry cards around and it can be verified at request. And the reason is this: somebody is telling you, oh, I was AA yesterday, today I'm AS, or I'm AS yesterday, today I'm AA. When you have that information, it's called informed knowledge. You can take informed decision about who you want to marry and all of that.
Ṣọlẹ̀ ṣẹ́gun àrùn gbogbo, ẹ̀fọn tó gbòòrò àtúnlọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́tùlẹ̀ gbàgbọ́ sàfún tọ́gọ́. Cleanliness is essential. Utilize your potential. Understand the times and your initial.
Mọ́tò tó borí àrùn mọ́lẹ̀, àṣẹ ní ká ṣe lọ́jú. Àyíká àlàbò yìí máa ń bá.